Awesome. All right, shooting it back over to you, Shogun, and you're on.
Thank you. So now that we've covered some of the basics, I want to go in this turn more in detail about why I oppose the practice of medical transitioning of minors in at least the majority of cases. I do want to make one more point about consent, though, just to rebut Hermes' point. So he's saying, well, this isn't a matter of consent. This is just a matter of receiving treatment. And obviously, children don't need to consent to receive treatment in many other cases. If your child has appendicitis and your child says, no, don't cut me open, I don't want the surgery, obviously you're not going to say, oh, well, they didn't consent, let them die. Of course not. That'd be ridiculous, right? If there's a medical issue of that nature, biological, antibiotics, injury, bleeding, etc., obviously consent is assumed and implied and made by the parents. I don't question that. But if we're being honest, we have to admit that the transgender identity issue is not that kind of issue. This is a combination of complex emotional, social, cultural, psychological, identity, behavioral, and lifestyle choices and decisions that people make in a fluid environment that changes as they mature and go through stages of their life. So this is not equivalent to, oh, well, my child needs brain surgery, or, oh, my child's bleeding, they need stitches. Right, so we can't pretend it's as simple as, oh, they're just receiving treatment. Sure, they're receiving treatment, but it's treatment for what is ultimately an emotional, psychological identity issue, however you want to look at that, and for which there are other alternatives available, et cetera, et cetera. So I just want to clarify that's not exactly an analogous situation, and other kinds of treatment could be attempted instead that would not biologically change that person. Or prevent them from going through natural developmental process. So that being said, so first reason why I oppose medical intervention, because the children are not old enough or mature enough to understand the implications of a decision that will have permanent effects on them developmentally, because regardless of if the puberty blockers themselves are reversible in the sense that you can discontinue them, what you cannot do is regain the lost developmental period of time. So the absence of development is itself permanent and not reversible, right? The fact that you can resume development when the drugs are stopped does not mean that you not go through that development and experience the changes or lack of changes during that period of time. And therefore, it's sort of facetious to call it reversible because it has permanent developmental effects, as you admit when you say, well, yeah, your penis is way smaller than it would have been. That's because it's not reversible. All you did was seed the drug and allow what natural process to try and catch up, but you can't get back the lost time. So it's irreversible in its effects. So again, the reason why is that the vast majority of children who identify as transgender will naturally re-identify as their birth gender. So therefore, it's fairly straightforward logic. If your child thinks that they're transgender, there's an overwhelming majority chance that they will later change their mind and re-identify with their birth gender. Therefore, the one thing you do not want to do is tamper in their biology, their neurology, or their physical body. What you want to do is allow them to explore these thoughts, talk about it with experts and psychiatrists, talk about it with parents and peers, try a different lifestyle, try wearing the clothes, try going by a different pronoun, try doing all those things as you develop and see if you like it and if you don't like it, and ultimately be prepared to make a choice when you're old enough and mature enough to do so, in the same way that we allow people to make other consequential choices when they reach an age of majority. What you do not want to do is take what is in the majority of cases a temporary and transient developmental crisis or gender identity crisis and lock it in artificially by chemically or biologically tampering in that person's body in a way that creates a self-fulfilling prophecy. Because if you give drugs to a boy that prevents his penis from growing and keeps him looking young and feminine, you are by definition, if you think about it logically, decreasing the likelihood of him successfully reintegrating into his birth gender. Because if he ends up deciding he wants to be a boy, he's not going to want to be a boy with a tiny little penis. And if he is a boy with a tiny little penis, he's more likely to make the decision to transition into a woman. But that doesn't mean that was his natural choice, because now you biologically altered him. So he cannot make a free decision from his natural state of development as an adult because someone tampered in his body when he was still a child. And I'll yield my time.
All right. You had 30 seconds just to let you know.
Okay, I'll use my remaining 30 seconds. So that being said, the mature thing to do, the responsible thing to do is provide education, support, therapy, counseling, resources, and identity exploration freely and in a supportive environment, but not do anything medically that will bias that child to making one decision or the other in a way that deprives him of his natural choice. or even influences it or constrains it biologically when it should be a psychological and social process.
And time. Awesome. Cool. Given some breathing room. Hermes, if you're ready, I'll give you a little heads. Let's
I'm
go
ready.
for it.
All right. So I'm gonna start with the refutation of like gender dysphoria not being like other disorders. So just because you can't like see it, like an organ is not like hanging from your stomach or whatever, it doesn't mean it's not real. Schizophrenia, bipolar, all of these things can be. You can say these are just socially constructed disorders. There are physiological changes and differences between those that have gender dysphoria. There has been studies, and the brain structure is actually different in most cases. It's not exactly like a woman, but it's not exactly like a man. It's weird. And of course, there are various factors for that. One of the factors is prenatal exposure to hormones. So that's why some people have that issue. So just want to make sure this is a very serious disorder, and I'm gonna read a little bit from Mayo Clinic so we can all understand a little bit more. So gender dysphoria is a diagnosis listed in the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, a manual published by the American Psychiatric Association to diagnose mental conditions. This term is intended to be more descriptive than the one that was previously used, gender identity disorder. The term gender dysphoria focuses on one's discomfort as the problem rather than the identity. A diagnosis for gender dysphoria was created to help people get the necessary health care and effective treatment. So there are, let me see for diagnosis and treatment, what you need. But in the meantime, while I find that, I just want to point out again, if the purpose of this is to minimize harm, then what Shogun said about the whole exploration thing is actually true, and that happens, right? So most of these clinicians have like year, 2 year, or whatever follow-up to make sure that you do explore, you're educated, you are taught and allowed to live your life, in specific ways, and then you're assessed by professionals to see if you will desist or not. And as was previously pointed out, this is very effective at screening people. So it is true that a lot of people desist, but the people that pass the screening, the vast majority persist, like 98%. So we need to focus on that because that's where the issue really is. So if 2%, right? Let's just say 2%, right, were to die, all right? And this is not even the case, right? But I'm just going to go extreme. Let's say 2% dies and 98% basically has a far, far, far better outlook at life. They won't get depressed. They won't get into drugs. They won't commit suicide. They won't do all that, whatever. So, or they will have a lower chances of doing that. Obviously, I'm exaggerating that 2% don't die. Of that 2%, not all of them, get those complications with the penis size or whatever. And you do actually resume growth. That's why the medical literature, again, I'm not an expert, but the medical literature from places like the APA, the top of the top, do actually point out that puberty blockers are reversible and effective for treating dysphoria. And the general purpose of it actually isn't to permanently change the body. The purpose is to give more time for further assessment, which is the most responsible decision that can be done, which is why every major medical institution with the greatest number of checks and balances, to make sure everything is done the right, not checks and balances, sorry, eligibility criteria to make sure that everything is gone through nice and smooth. So here are, and I think I've pointed this out, but the World Professional Association for Transgender Health provides the following criteria for hormone and
1 minute.
surgical treatment. So persistent, well-documented dysphoria. So that means that the desisters, are basically screened out from this. Capacity to make full informed decision and consent to treatment. So you still even even as like a 16-year-old, you still have, or a 15-year-old or 14-year-old, you still have to say yes, and you have to be, cognizant. And of course, in many cases, you have a parent, and more importantly, you have the professional following best medical practices and best guidelines. So, I mean, I'm not even an expert on this, but I mean, all the studies seem to point out towards it being vastly beneficial.
10 seconds.